Again, as Dr. Abbasi mentioned, don't let these signs stay quiet. Talk to somebody in your community, talk to a family member. Never let these signs be alone by themselves or with you. Discuss it with a family member. Thank you so much, Dr. Abbasi. Our next, or in fact our last speaker is someone we are very excited to have with us. We were told of her professional achievements and her tireless work on mental health. Dr. Tareen serves as Associate Professor of Psychiatry at WMed. She was trained as a dermatologist at the University of Wales in the UK and later completed her residency in psychiatry at Michigan State, followed by subspecialty training in psychosomatic medicine. These words are a little difficult, so excuse me there. Her area of interest are women behavioral health, psychodermatology, and transitional magnetic stimulation therapy for severe depression. She serves on the board of the Kalamazoo Academy of Medicine and is actively involved in Michigan State's Medical Society. Put your hands together for Dr.
It's not a PowerPoint because the previous one was up. It seems like a PDF. It's not really good slide. Assalamu alaikum, Chicago and Michigan. Well, it was such a wonderful presentation, Dr. Abbasi and from Dr. Chalisa, that is hard to kind of capture your attention anymore, moving on, but I would request, that we can, spend a few minutes since we made an effort to come here and talk to you. I would really appreciate it. I think all of our topics are interconnected, we talked about domestic violence, how it affects our mental health, how it affects our create generational effects, affect our physical, health, and so there's nothing which happens in a vacuum, correct? There's nothing which happens in a vacuum and just can be dealt in it. So we all are interconnected in this way, so we should be aware of it. I know that not many of us are in a childbearing kind of stage, but our next generation is going to be, and this is just for the awareness, so we can prevent things from happening. We can recognize the signs happening around us, and we can ask women to get help. So with that, I'll present to you 50 Shades of Blue. Can I have your attention, please? So, I'm sorry this is not working very well, but today we are going to talk about the perinatal psychiatric disorder. Perinatal means that it can happen during pregnancy, it can happen after pregnancy, immediately after pregnancy, or even up to 1 year after pregnancy. So now we consider postpartum phase up to 1 year of pregnancy. And why should we worry about it? why we have to talk about it? Well, because about 4 million babies are born in USA. We're not talking about Pakistan because I don't know the exact numbers. But we know that 4 million babies are born in USA every year. And guess what? Half of them are unplanned pregnancies. So by the time a woman gets pregnant and 4 weeks are gone by, 6 weeks are gone by, they don't even know they're pregnant. So there's not much time for us to intervene. So we have to know about it beforehand. And one of every 7 new mothers suffers from some level of depression. That's a high number. Because, these women are very afraid of sharing this, that they're feeling depressed. Why? Because pregnancy is considered to be this happy, joyous time when you should be glowing with pregnancy, and we should be feeling, on the ninth cloud. But these women are not, and they're embarrassed and they're fearful to talk about it. And more than 80% of these women go undiagnosed and untreated. 15 to 20% of these women go untreated even when they get diagnosed. So that's a shame for us. Why women who are pregnant or postpartum get depressed? What makes them vulnerable? Well, there's a lot of psychosocial factors. Some of them Farah talked about, like, if you don't have good social support, if you are in a marriage where there is a lot of, discord, if you are suffering in your partner violence, if you are, a much younger woman, like 19, 20, versus you are a much older woman, both conditions make you much more likely to get depressed during pregnancy. If you have multiple pregnancies and you have several children, most of the pregnancies are less than 1 year, apart, that makes you highly vulnerable. If, as I said, if it is unplanned pregnancy, unwanted pregnancy, or women have gone through fertility treatments. What fertility treatment do is play with your hormones, correct? And the whole depression in pregnancy is related to the hormonal disturbances, correct? So that is a high risk factor. If you are poor, if you are living in low-income urban areas, or if you are, African American women, you're more likely than not to get, depressed. Now we don't have any numbers about what about us, Desi women. I don't know. What I mean is women from South Asian countries who are living in USA. I don't know because we don't have those numbers. So maybe there is some factor which is playing a part in it, because when we go to the hospitals here during pregnancy care, we are not in the same kind of societal and cultural background as we would be back home. And most of the time our families are not here to support us, right? Just like back home, we don't have that support. So it's likely that you will feel lonely. Then there are your own personal psychiatric factors. If a woman has a history of mood disorder, whether it is depression or bipolar disorder, or if it is anxiety disorder, obsessive compulsive disorder, PTSD, alcohol and drug abuse, sexual abuse as a child, or grief of losing a pregnancy. If you were pregnant and you had a miscarriage or has a baby who unfortunately passed away, imagine going through the pregnancy next time, how traumatic it's going to be. Every step of that pregnancy is going to remind you of the pregnancy you lost. So you are much likely to get depressed. And obviously, if you have premenstrual dysphoric syndrome, means that you are very vulnerable to the hormonal variations. So you possibly are going to be very, very vulnerable to the hormonal variation in your pregnancy, and that can cause you to be depressed. If you have a family history of either postpartum depression or prenatal depression or just the mood disorder, you're likely to be more vulnerable. And And also, if you were on antidepressant and your doctor told you to stop it when you found to be pregnant, you are going to get depressed. Actually, almost 70% of those women get depressed during pregnancy. Again, these are the same factors: genetic factors, environmental factors, nutritional and factors, and life stressors. What we just talked about, is more of a diagram and presentation, can lead to depression in pregnancy. Can you adjust the slide, please? I think this is breakdown. Yeah. Thank you. So, antenatal depression or antenatal PPD is the depression during the pregnancy. And as we talked about it, it is usually overlooked. The symptoms women experience during antenatal depressions are very closely related or mimic the symptoms you have in pregnancy. For example, you don't sleep very well, you are not likely to eat certain things, you feel like you don't want to eat much, your energy is low, you have decreased sexual drive, and you have mood lability. Sometimes you are happy, sometimes you are depressed, sometimes you are irritable, and all of that get easily attributed to just being pregnant, right? And you may go undiagnosed or unrecognized just because of that. So how we differentiate it? Well, if you are showing no interest in pregnancy, if you are having all the time this guilty rumination, like blaming yourself for everything, which is a tendency women do, whether they are depressed or not. So, or if you have a inability to find joy in anything, or you suddenly start having suicidal ideation, that is a clear sign that there's something else besides pregnancy-related mood changes. So, what do we see in postpartum, right? So, postpartum blues, I can assure you, most of us have gone through that. Most of us went through pregnancy deliveries. In the first week, after the excitement and joy of having the baby, 85% of women go through that. And as clinicians, we consider it almost like a normal phase of postpartum, because there is, remember, your hormones are surging throughout the pregnancy, right? They go over 1,000-fold. And the day you deliver, the minute you deliver, it goes down like this, right? So why everybody doesn't get depressed? Why? Because everybody reacts to these hormonal changes differently, right? And so, but a large number of us do react to this sudden change. And what happens is that, the symptoms start peaking in 3 to 5 days, but good thing is that they resolve within a week. So it's a transient phase. It should usually go away. If it doesn't go away, then it becomes postpartum depression, which happens in the first 4 weeks of pregnancy, but now with the new definition, it can happen anytime from the delivery till 1 year of, a delivery. And I'll tell you, where is the peak? The peak is at 3 months. What happened at 3 months? In USA, most women go back to work at 6 weeks. Right? They can sometimes take 6 more weeks after that if they want to, without pay or less pay. But this is the time when most women are returning to their normal way of life. And leaving baby behind is the worst fear for them. No matter who is taking care of the baby, even if your mother is taking care of the baby, you're always going to worry about it, right? So returning back to routine life, if you're working, is a problem, but also if you started getting depressed, the depression peaks around 3 months, and usually come to attention at that time. It's about 10 to 15% of women who get depressed after pregnancy, delivery, but if you are an African American woman, up to 35%. If you are living in a poor urban community, which some of us could be, you have higher risk, about 25%. And then if you are much younger, like a teen pregnancy or delivery, it's also much higher. Majority of them, if they get depressed, suffer for a long time, at least 6 months. And about a quarter of them remain depressed until 1 year of postpartum, if they are untreated. And if they're not treated, even then it persists for years to come at some level and cause a lot of problem. Now, if you can bring it down a little bit. Thank you. Postpartum psychosis. Thank God it's a very rare phenomenon. Only about 0.1 to 0.2% of women suffer from postpartum psychosis. However, it's a real emergency. Why? Because they become really psychotic. Delusions, paranoia, and most of the delusions are about baby. And most of the time they go on and do things which, out of love and fear for the baby, which are not true, but they truly believe in it. You may have heard about India White, who drowned all of her 5 children in the tub, things like that. She was a loving, caring mother, but she became really psychotic. And not that she was psychotic in the beginning, she was depressed, but there were little factors. She lost her father, she was homeschooling all 5 children, etc. But that happens, and the fear she had was that there was a big calamity was coming, and Satan is going to take over her children, so she would rather protect them by killing them than to let the Satan have hold of them. And women truly believe in it. So that's a real emergency which we need to kind of identify and get them help right away. What happens if you don't treat the depression? It's not just about, remember, our bodies are interconnected with our brain. So the depression does not just live in brain and just doesn't harm anything else. It affects us from head to toe. And what happens? If you are depressed during pregnancy, your chances of getting preeclampsia increases significantly. Your chances of using therapeutic substances like smoking or alcohol or marijuana increases significantly. Why? Because you want to feel better, right? And so it is very harmful. You do gain weight way more than you should gain in pregnancy. You might do more, destructive things, self-destructive things than you would not if you're not depressed. If you don't treat depression, it's not ends there. It just affects their ability to develop the attachment and bonding with their infant. They're not likely to respond to the infant's cue. These women, they just don't, it's spring to the moment when the baby starts crying, they just feel like, do I need to really, why, kind of thing, They just don't have energy, don't have desire, don't have the ability to kind of respond to the baby, right? They have, even if they respond to baby, just because they have to show others that they are taking care of the baby, this attachment to baby is very insecure. And if you look at the attachment theories, insecure babies are destined to not do well in their lives. Never. They are not confident, they are not good in school, they are not good at making social connections. They are just not, designed to be successful. So it's truly a generational problem. And if they're depressed, they don't follow through their OB/GYN appointment, they don't eat healthy, they don't show up for their follow-ups, and their depression becomes lasting. And these are the women who don't usually follow up with their primary care, so they show up in ER again and again, etc. Now what happens if you don't treat depression when baby is forming in the womb? Well, as Farah said, the day when the baby conceived, the baby is in direct connection with what's going on in your brain, right? That's why we suggest that you read when you are pregnant, when you do good things so that your baby understands what is the natural rhythm of life, things like that. So, these babies don't gain weight very well. These babies have sleep problem, temperamental problem. Remember, some of the babies just don't stop crying. They're not able to give, get comfortable. They have difficulty latching on to the breastfeeding. They have behavioral problems, delays in language development, delays in social development, and when babies have poor and insecure attachment, as I said to you, they have likelihood of developing conduct disorder. And I don't know how many of you know, but conduct disorder is the precursor of developing antisocial personality, which is criminality, getting into trouble for one thing or other, things like that. And also they have school behavior problem, ADHD, etc. Depressed women, mothers, their offspring, especially if they're boys, they have a lot of behavioral disturbances. They have cognitive vulnerability to depression, even when they are 5 years old. And this is all research-based. They have reduced performance on Bailey scale, which is an IQ scale we use for children under 2. They show less cognitive abilities than their counterparts. And if the mothers is and the other characteristics of postpartum depression is there's a lot of anxiety associated with that. It's like a depression with anxious distress. There's a qualitative difference in this postpartum depression with normal depression. There's no normal depression, but usually that's disorder. And if the mother is very anxious, these offsprings have shown to develop hyperactivity and attention deficit disorder, especially if the offspring is a boy. So, we should treat postpartum depression, perinatal depression, and how we can treat them when we identify them, right? And I'll tell you how we can identify them. One is just doing this. The number one thing is to just know about it, right? And support other women. Support our children who are going to be young mothers, support their friends, and just tell them that it's okay to be depressed. It's okay to feel like that, and okay to get help. And once we recognize that, we have to, as a physician, what we have to do is to do a full psychiatric and physical evaluation first, psychiatric evaluation, and then, if we think that this is treatable by just supportive psychotherapy, that should be the first step. We should refer them to psychotherapy. Most community has support groups, in some form or others, and that's the best place for them to be. Peer support is always shown to be much more helpful, than somebody talking to them, and also, if really necessary, to use antidepressive medications. We should always ask them about suicidal ideation, because this is the question they usually, this is the thing which they won't divulge until unless you ask them, because they're so ashamed of themselves to feel like that. They're so ashamed of themselves to not feeling happy with the birth of a child that they would never tell you how bad things are. And if they are dealing with suicidal ideation, it's a very high risk that they might do something. So, sometimes asking about it is very, very important. So again, the postpartum depression doesn't happen in vacuum. There is a whole circle of events and predisposing factors which can lead to it, and we need to kind of be aware of it. Can you please bring down this? If you are a physician, please use a very well-known postpartum depression scale, which is Edinburgh EPDS or Edinburgh Postnatal Depression Scale. It is validated as an antenatal pregnancy or depression also, so you can use it with equal, efficacy. Any score of over 10 or any score which include the positive on question 10, which is the question 10 is about suicidality. If somebody is scoring 2, but they are scoring yes on the suicidal question, that is considered serious depression. And so, we should do it in the beginning of the pregnancy, at least once at 28 week of pregnancy, and then postpartum. This is a very good, very nicely written depressive scale. Women say that they really feel that the question asked are very, very simple to understand, and they can relate to it. Now, it has been translated in 140 languages. I myself have translated in Swahili because we did a project in Madagascar. So almost a lot of countries have had some version. Here is the Urdu version for you. It's available. It's in public domain. You can download it from the internet, and very, very effective, scale. And who should screen? Anybody can screen, but your primary care is likely to do it if they want to do it. But OBGYN, AYN, and other providers. Now I tell you what, we realized during one of the research projects we were doing that low-income women get Medicaid in Michigan. I think it's a federal grant that they get insurance if they don't have insurance, Medicaid for pregnancy. And 6 weeks after pregnancy delivery, they lose it. So the only provider who can screen them are pediatricians, because they still have insurance for the babies. So when they go to visit their pediatrician, they can be screened. And so we trained pediatricians to do this scale, and that was very, very effective. So your communities can do that. Again, if possible, non-pharmacological treatments always good, but if not, then we can do medication, we can do transcranial magnetic stimulation, or ECT, is electric shock therapy, is indicated in pregnancy if the woman is severely depressed or severely manic. It does not harm baby in any way, it doesn't harm the mom. Transcranial magnetic stimulation is completely safe also, it can be done. And to be honest, medications we use, antidepressants, are pretty safe in the pregnancy. However, most women get very, very concerned about using them. So decision to use medication is a very heavy medication decision, but it should be discussed thoroughly. To tell you what, if you are living in a bubble during your pregnancy, if you are not taking any medication, not even the multivitamins, correct? Still, you have a chance. Any woman has a chance to have a baby with congenital birth defects up to 2 to 3%. So, 3 in 100 women can have a child with birth defect even if they're not taking anything. Now, when we use, and that could be from genetic predisposition, that could be from environmental toxins, that could be because of, child suffered birth injury, whatever, However, when you use SSRIs, which is the first-line treatment for depression, serotonin reuptake inhibitor medications, we fortunately have a big registry of Prozac. Prozac was the prototype, you may have heard about it. Prozac has a running registry of pregnant and nursing women since the day of it came out, because everybody was very skeptical about it. And so far, the birth defect has stayed under that rate of 2 to 3%, which could happen with anything, without anything, correct? And so none of the SSRIs has shown any serious birth defects or growth problems or anything like that. So, if any of your friends or anybody is suffering from postpartum perinatal depression, do know that from 4 to 8 weeks, it's a time when baby is just forming, all the organs are developing, and there is a chance that miscarriage or teratogenic anatomic defect can happen, or other embryopathy can happen. But after that is passed, after week 12, baby is just developing, all the organs are formed. The organs which will continue to mature throughout the pregnancy, like lungs and kidneys and all those things, liver, but they're not developing per se, they're just growing now. And your brain, children's brain continue to grow well into puberty, right? So those things, are not going to be affected. In fact, there are head-to-head study of pregnant, depressed women on SSRIs and babies born to women who are not depressed. And they have tested children at age 5 and in kindergarten, and they have found no differences in language development, no differences in temperament, no differences in cognitive, abilities, nothing. These children were exactly same as their counterpart who were born to mothers who were not on SSRIs. So there is tons of evidence now that women who are depressed can be treated very well throughout the pregnancy when they're nursing, because nursing is important, and no woman should not nurse their children for the fear of affecting the children's development, because that's not true. So, can you please bring it down? Just a message that we should consider postpartum depression or perinatal depression as an important public health concern. It's a generational disease. As I said, babies born to depressed mother, anxious mothers are not healthy people. A study has shown after 30 years of these children, these adults, when they tested them, they have, as Farah also alluded to that these children are more likely to develop heart disease, substance abuse problem, and hypertension than their counterparts. So it is important for us to recognize it, and we should not let it undiagnosed and untreated, and we approach this challenge as a sequential strategy, and things like this, just teaching each other. I learned a lot from other two speakers, and this is our job to keep on learning. And what to do if somebody needs help? Well, there's a national crisis line, and I tell my patient to remember this 988. Just like 911, 988, this is a crisis line. It's staffed by a trained professional, not an answered service, so please dial that. There are other resources also which you can access. And this is my university that we met, and come to Kalamazoo to visit us sometime. Thank you very much for your attention.